All right. Hi, everyone. We're going to go ahead and get started. For those of you just joining, welcome. This is my webinar on understanding neurodiversity and neurodivergence, ways to be more affirming and aware. Hi, my name is Goodhand, and I am a psychotherapist in training and have been working as a therapist for the past year at My Therapy NYC. And I'm going to be talking to you about this topic today. So if you haven't noticed already, there's currently a poll asking you, how familiar are you with the term neurodiversity? So feel free to respond and let us know where you're at, whether you're not at all familiar with it, somewhat familiar, or very familiar, or you feel like an expert. And while you decide that and figure out where you're at and answer the poll, if you're comfortable doing so, I'm going to tell you a little bit more about some background. So I'm a therapist at My Therapy NYC. My pronouns are they, them, theirs. I do a lot of work with the trans and queer community and a lot of neurodivergent folks from my clients. I personally identify as neurodivergent, and I'm going to be centering the lived experiences of people who are neurodivergent in this conversation, including educators, activists, writers in this conversation. Much of the research and the visuals that are going to be in this presentation are also coming from people with lived experience, including at Lived Experience Educator. They are on Instagram. They are a disabled, non-binary, multiply neurodivergent educator and author. So some housekeeping items that I want to run over with everyone. If you have any questions during this conversation, please feel free to put them in the chat box to be addressed at the end of the Q&A part of the conversation in the last 15 minutes that we'll cover. There's also closed captioning available if you'd like to see what's being said during this conversation. If you would like to see the captions and the transcript of what's being said throughout the entire conversation written out for you, below you should see a button that says closed captioning. Right next to it, there should be an arrow option that has a ability to select show full transcript, and that way you can see what's being said. Some trigger warnings, content warnings about some of the topics that we're going to be discussing in this conversation. There's going to be conversations about ableism, as well as the mental health struggles for folks who are neurodivergent. Additionally, an overview of what we're going to go through today. We're going to focus on neurodiversity, what it is, why it matters, and how it's connected to mental health, along with ways that we can build supportive and affirming relationships with people who are neurodivergent, whether it's ourselves, our clients, or a loved one. So the origins of neurodiversity. Judy Singer, an Australian sociologist, in her thesis in 1997 to 1998, described this term, which she came up with, as a political term, not a diagnosis, meaning a state of nature, an evolutionary variation in brain types being normal. This term is an analytical tool for examining social issues around human variation in brain types. So this term was intended to be an argument for the conservation and facilitation of human diversity. It is not a synonym for neurological disorder. It basically is describing how, obviously, we know that every brain is different from others in some way, but this is a way to view some of the brain differences, including neurological differences that people can face marginalization for showing that difference in having. Judy Singer describes how her original concept of neurodiversity was as an addition to the categories of intersectionality, thus an analytical lens for examining social issues, such as inequity and discrimination for these folks. So essentially, she came up with this term neurodiversity as an umbrella term, as a possible name for a civil rights movement for the neurological minorities beginning to coalesce around the pioneering work of the autistic self-advocacy movement. So what does this mean? Neurodiversity came for Judy Singer out of observing how people with neurological differences were facing marginalization, were being discriminated against and pathologized as being considered wrong, which means that this experience of marginalization would also be intersectional, meaning added on to the other experiences of oppression. For example, like being a woman in a patriarchal society, being queer, being transgender, like being Black, being Asian, etc. Which means that a white woman's experience of marginalization for being neurodivergent would be different from a Black woman's experience of marginalization for being neurodivergent. So from that concept, Cassian Asasumasu, a biracial multiply neurodivergent activist, created the term neurodivergent, referring to anyone whose mind or functioning diverges from the dominant societal norms, standards, and expectations. So not all individuals who would qualify as being neurodivergent are necessarily familiar with this term. Not all of them identify with it or know about it. Neurodivergent isn't necessarily a diagnosis. It is a political identity representing the marginalized experiences that many individuals with neurodivergence can often have. It is not a medical or clinical term. It is an identity. And some examples of these identities of people who diverge from dominant societal norms, standards, and expectations and how they function, how their mind works, could be folks with PTSD, folks with ADHD, autism, Downs, schizophrenia, epilepsy, etc. And on the left, you can see this visual umbrella of examples of non-exhaustive identities or diagnoses that fall under this neurodivergent umbrella. So now that you know what neurodivergence is, what kind of people fall under these umbrellas, what percentage of people, if you're comfortable putting in the chat what you think a percentage might be for a guess, what percentage of the human population do you think globally experience some form of these kind of neurodivergences? That is, diverging from dominant societal norms or expectations and having a way of functioning or a mind that works differently than the majority of people. So please feel free to respond in the chat if you're comfortable, what percentage or number of people that you think it is. And while you're thinking about that, I'm going to share more info about some more identities or diagnoses that neurodivergence can look like. So we know that individuals with neurodivergent traits may meet diagnostic thresholds for what you may have heard as neurodevelopmental disabilities, for example, ADHD, like dyslexia, autism, dyscalculia, dyspraxia, developmental language disorder, tic disorder, cerebral palsy, and learning and intellectual disorders. And these are non-exhaustive. These are not all of the forms of neurodivergence. These are just some common examples of folks who would qualify as having this kind of difference and divergence from societal norms and expectations. So hopefully you've had a second to take a guess what percentage of people you think exhibit some form of neurodivergence. So let's see what we got. Okay, we have 75%, 40, 50%, 90. Rebecca said 90 as well, 85%, 50 to 60, 75, 80. All right, so we got some high numbers overall. So let's see what research can tell us. So based on a research study done by the National Cancer Institute, 15 to 20% at least of the population we know exhibits some form of this kind of neurodivergence. And this is an at least number because there are a lot of discrepancies in diagnoses and characteristics getting missed by professionals, because not a lot of times everyone has access to a diagnosis or clarity around what kind of neurodivergence they're experiencing. So for example, ADHD is often underdiagnosed or misdiagnosed. So we know that these numbers, we're not completely sure. So where does neurodivergence and mental health come in? Well, research has shown greater rates of depression and anxiety co-occurring with autism, ADHD, and dyscalculia. Some more researched examples, unfortunately, we don't have so much research on these co-occurring experiences, except for the more researched neurotypes, which is types of brain, types of neurodivergence. So we do know that ADHD, for example, is usually accompanied by other psychiatric mental health struggles, like major depression, anxiety, alcohol and substance use issues. Adults with ADHD are more likely to present to psychiatric clinic for treatment of their other diagnoses or other mental health struggles or issues than for their symptoms of ADHD. and their ADHD symptoms are often mistaken for other diagnoses. And then another example we know from research is that autism is associated with greater rates of anxiety, eating disorders, gender dysphoria, mood differences, OCD, having received personality disorder diagnoses. And we also know that autism is commonly underdiagnosed and misdiagnosed, unfortunately. So why is this? Why are we seeing such high numbers for these two examples of neurotypes with ADHD and autism and dyscalculia with mental health struggles? Well, here is a visual showing two different explanations for what someone struggles with in terms of neurodivergence and or disability, and different ways of framing that. So on the left, you can see the medical model, and on the right is the social model. The medical versus social models are both ways to conceptualize and think about neurodivergence and disability. The medical model on the left is a way of looking at people's differences in neurodivergence. Again, neurodivergence is anyone whose mind or functioning diverges from the dominant societal norms, standards, and expectations. And the medical model on the left, which you can see the arrow sort of pointing on the child in the middle, is it sees these diverging pieces as something being wrong with an individual. They sort of see it as it's an internal problem, so this person needs help. They can't function on their own. They need a cure and treatment. They need behavioral interventions to help make it less obvious. Historically, people with neurodivergence experiences have been placed under this medical model, which frames these differences as being disorders always. That's sort of a generalized way of looking at it, as pathologies in need of being cured, kind of like sicknesses. For example, like how you go to a doctor when you're sick to get better, you want to get fixed. And in the history of psychology and mental health, practitioners in theory often frame people's differences in brain types and their divergence from social norms as being something wrong with them, something that needs to be cured or fixed. And this is pretty common in psychology in the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders. So this pathology medical model theory sort of sorts people into boxes of being right and wrong, disordered and not. Whereas on the right, you can see the earth and arrows pointing away from the earth. This social model sees someone's neurodivergence as being inherently neutral, and that the pieces that they may be struggling with as coming from external barriers to accessibility, from the way that their environment resists their differences, like environmental barriers and lack of support and access to support and people who know how to support these differences, from organizational barriers, like not getting comprehensive medical or mental health care from people who can understand their experiences, from the social expectations that they are often going against, from social and cultural expectations that can lead to them receiving social judgment and stigma, and communication differences and not being understood by the majority of people, and a lack of understanding, and how those things can cause so much of these struggles that they can experience. So the social model argues that people's differences are not necessarily internal sicknesses, but that their struggles come from living in a world that was not made for them and how they operate. In a world that was not made for them, that doesn't allow them access, accommodations, and flexibility or adaptations for their differences. That their struggles can often come from dealing with external barriers, like organizational structures that aren't supportive, a lack of accessibility, a lack of understandable communication, and social and cultural rules that they might be punished for breaking. And these forces make it hard for people who diverge in the first place to exist. So this neurodiversity theory and paradigm that we're going to be centering argues that neurodiversity is a natural human difference. And the idea of a healthy brain is a social construct coming from a medical model that assumes that people are wrong if they don't fit it. And the neurodiversity model is arguing that these kind of variations don't have to be deficits or disorders, They're neutral. They're part of evolution. They're part of science and how our brain types are different naturally because of these factors. So an important thing to note, under this umbrella of neurodiversity, there are neurotypicals. Neurotypical is a term that refers to people who have a mind or functioning that is what society considers normal or common. And neurotypical people are under this umbrella of neurodiversity, understanding how brain types diverge. We have neurodivergent folks and neurotypical folks under neurodiversity. And it's a way of looking at the variation in human brain types that include neurotypical brains that are the people in the majority who function, think, and follow most social expectations. And then we have neurodivergent people who diverge from that norm or majority way of functioning or thinking. So because of that, and these forces that we've talked about so far, people who are neurodivergent often experience a lot of stigma and marginalization, enough to the point where Judy Singer came up with the term of neurodiversity as a political term to describe it. So here are some non-exhaustive examples from some of the more researched neurotypes, which is brain types, type of neurodivergences, that fall under the neurodivergent umbrella. So in terms of ADHD, research has found that many adults with ADHD are systematically misdiagnosed or underdiagnosed by clinicians. Often clinicians confuse many adults' ADHD symptoms with their other psychiatric mental health issues instead. And then in terms of autism, there is external and internalized stigma around autistic folks coming from so many different directions. For example, Greta Thunberg, an autistic climate change activist who most of you have probably heard of, she was called by Michael Knowles on Fox News, and I quote, "a mentally ill Swedish child who is being exploited by her parents and by the international left," end quote. So what we're seeing here is an example of the kind of infantilization and condescension that happens for autistic folks, many occasions on a daily basis, which can be part of this stigma for people who are autistic or for people who show signs of being autistic. And this is one example of so many different ways that this stigma can look. So we know as well that there appear to be biases against individuals with developmental disabilities and or people who are neurodivergent with developmental disabilities, which can be a part of their neurodivergence. In the realm of mental health, which Irvine coined in a thesis paper, she called this kind of stigma neurotypical normativity, which is referring to how little training or education is often given to mental health and medical professionals to support working with people with neurodevelopmental disabilities. So these biases are unfortunately really common in the mental health field and can cause a lot of blind spots in providers who work with these folks. Often this can look like providers prioritizing treatment for changing these individuals' behaviors and trying to limit their symptoms of neurodivergence, rather than focusing on their emotional well-being in general and their personal goals and definitions of what success looks like for them. So if the people who are getting this training in the helping profession and in the healthcare field are receiving blind spots and misinformation or a lack of information about how to help these populations, that means that those of us who aren't receiving training for the helping profession probably have similar blind spots because we're not receiving that training if we haven't been trained to be helping professionals. And in this conversation, I've been using the term disability. There is a lot of rhetoric around folks who aren't disabled, who don't like to say this word. It's often considered a dirty word, a bad word. People would rather say like ability status or differently abled. But as a member of the disabled community, we embrace this term. This term is part of our identity and part of our experience. So the definition I'm going to be using when I say disability, I'm going to be referring to disability as the experience of any condition or experience that makes it more difficult for a person to do certain activities or have equitable access within a given society. And that is a reference to a social model of how we can view disability as being a part of an issue with not being able to have equitable access because of the society that we're in. So what is ableism? Where does disability come in? Ableism is the overt and covert discrimination and social prejudice against people with physical, intellectual, communicative, or psychiatric disabilities, and people with neurological differences and neurodivergent populations. And this way, framing it as coming from the Therapist Neurodiversity Collective. Ableism is the belief that neurodivergent and or disabled people are broken and in need of being fixed, which is kind of coming from this medical model that we touched on earlier. So why does ableism harm? Well, ableism presumes that the non-disabled and or neurotypicals are inherently superior, and that others with disabilities or neurodivergence should try to be like them and try to conform to how they do things. And this essentially devalues, dehumanizes, and disrespects people who don't. It can cause trauma. It can invite shame, lead to poor self-esteem, anxiety, and depression. It essentially keeps disabled people and neurodivergent folks in perpetual childhood, often. And it can eliminate equitable access and self-determination, and it can violate body autonomy. And what this can look like for folks who are neurodivergent is internalized ableism, which can involve self-blame, shame, internalized ableist beliefs about themselves. For example, I'm the reason why I don't fit in. I need to change and act more like most people so they will accept me because I'm not enough as I am. There's something wrong with me. And that is often how these ableist forces and ways of looking at things can often be internalized inside of us who are neurodivergent and or disabled. So what is the overlap or difference between neurodivergence and disability? Well, Annette Estes, the director of the University of Washington Autism Center, described how neurodivergence can be associated with disability and mental health struggles, but not in all cases. Some people who are neurodivergent may also have a disability, or their neurodivergence may be disabling in certain circumstances. This means that people who are neurodivergent do not always experience disability, but in some cases, their neurodivergence can include disability. And the neurodiversity paradigm and theory that we're centering in this conversation doesn't argue that it's always positive or easy to experience these differences that can include disability, but that, as Sunny Jane Wise at Lived Experience Educator on Instagram describes, we shouldn't consider people who are neurodivergent as broken or disabled. We can do it differently. We can see it differently. So why does this matter? What can we take away from these forces and these issues? Well, because of ableism, stigma, neurotypical normativity, and marginalization, we know from research that there is inadequate training to inform professionals and helping professionals how to work with clients and patients who are neurodivergent. For example, research has found in multiple studies, for example, that traditional mental health services generally do not meet the needs of autistic adults who are struggling with mental health problems. And from that example, and from all the other research done, we know that there's not many people in the helping profession informed on how to support and encourage people who are neurodivergent, as well as those of us who aren't in the helping profession, because the helping profession is supposed to do better, which means that ableism outside in society is showing that there's not this kind of informed ability to know how to support these folks. So we know that ableism is deeply embedded in our culture and how society views people who think or function differently, along with the added pressure of trying to deal with what it's like to live in a world with barriers for people with these neurological and functioning differences, those who are neurodivergent. And living with these barriers and ableism can cause people who are neurodivergent to struggle with more mental health issues, because we know from research that ableism is associated with negative mental health outcomes. So on the left, we can see a graphic describing different types of ableism, how it can be institutional, internalized, and interpersonal. And what example of institutional ableism is having a bus that isn't wheelchair accessible, as well as not being able to receive informed support from helping professions or the mental health system. And then interpersonal barriers can look like social judgment for speaking differently and showing signs of being neurodivergent, and how there can be judgment for that. And internalized ableism that we touched on before is that kind of ableism where the blame goes inward and it becomes shame. So how can we do better? Well, neurodiversity paradigms suggest that because neurological differences are normal and have existed throughout human history, they should be respected, understood, and supported, rather than pathologized or viewed as disordered. And as the Psychology Today staff wrote in an article and framed this as, there is nothing to cure. Modifying the environment of a neurodiverse individual, reducing stigma, prioritizing each person's inherent dignity will, proponents argue, allow for such individuals to discover innate talents and thrive within a neurodiverse society. And basically what this suggests is that individuals who are neurodivergent can have a chance at thriving if we work to modify the environment, reduce the stigma, and prioritize each person's inherent dignity and worth within this diverse society. And on the left, you can see a quote from a lived experience educator describing that being neurodiversity is not about being, yay, it's always a positive experience. Being neurodiversity affirming is about going, you are not disordered or broken for how you function or your experiences. How can I support you? Which means focusing on prioritizing individual autonomy, honoring what neurodivergent folks have to communicate, and prioritizing their dignity and their ability to choose what their support needs might be. And when I say affirming, I'm going to be using this definition with these synonyms. Affirming means confirming, validating, encouraging, and supporting. And part of my training and experience as a therapist has taught me that the only way I can fully support someone is if I have a foundation of being affirming for them as they are, with whatever they're coming in with. And that is what allows me to be able to support them as they are. So how have we been doing this? Well, some folks doing therapy have found some great ways to bring neurodiversity affirming frameworks into doing therapy. And these are some examples that we can apply to realms outside of therapy and outside of mental health field. In the way that Antonio Siciliano, a neurodivergent therapist at Michigan Counseling and Referral Services, described, neurodiversity affirming therapy highlights and affirms your strengths as a unique person. It does not attempt to point out your differences as negative and a hindrance. If we want to see the positive change we need in the world, it is important for us to recognize our differences as strengths. For example, ADHDers are great at hyperfixating and thinking outside the box. Autistic folks are very honest and analytical. OCDers are incredibly adept at assessing and keeping a space safe, as are trauma survivors, and so on. And the McLeod Acosta Clinical Services, another therapy practice, described how a neurodiversity affirming therapist approaches therapeutic work with the understanding that ADHD, autism, dyslexia, Tourette's, OCD, dyspraxia, and other conditions aren't problems to be cured or solved, but individual neurotypes with unique strengths, needs, and challenges. So what can we take away from this, from these ways that other people have been framing how to be affirming? It's important to note that this attitude towards being affirming of neurodivergence, it's not mutually exclusive from supporting people who may be struggling with challenges associated with their neurotypes. Challenges that also can come from living in a world that was not made for them. Living in a world that was not made for you is challenging. It's not always easy and strong. It can be hard and it can feel impossible at times to live in a world that isn't built for you. So it's about letting neurodivergent people identify what they want to work on and what they're struggling with, and not seeing the way that their brains work as being disordered or atypical. And for those of us with internalized ableism about our own neurodivergence, it means shifting our perspectives of how we see ourselves and our struggles, and recognizing our inherent worth and starting to cultivate compassion for ourselves as we are. And this means working to give ourselves the compassion and acceptance, and working to believe that our needs are worthy of being met. So, in neurodivergent fashion, I'm going to give you some concrete examples, because examples are important. Some concrete affirming ideas in the context of mental health care practice ideas. Here are some examples of green flags for someone being affirming as a therapist or helping professional, according to at-lived experience educator Sunny Jane Wise. And these are ways that we can support people in general who are neurodivergent, and practices that those of us who are neurodivergent can advocate for to meet our own needs, depending on what our needs are, what our challenges are, what our strengths are, depending on what would help us. So I'm going to go through the examples. The first green flag is that you allow individuals to define what is ideal functioning for them. Second, honoring the client or person who is neurodivergent defines what success means for them, rather than preconceived notions of neurotypical success. The successes aren't necessarily the same. Third, that you accept co-regulation and interdependence as valid. Individualism and working things out on your own doesn't always have to be the expectation or necessity for everyone. Not everyone has the ability to be able to do everything on their own. And it's okay to be interdependent on other people to support you. Fourth, you provide alternative methods of communication. Only allowing for spoken communication means excluding people who are neurodivergent that are nonverbal communicators, or can become nonverbal during moments of distress, which is really common for many autistic folks when they're experiencing distress. Verbalizing words during that time is not always an option. And then fifth, you try to understand the reason, thoughts, and feelings behind behaviors and actions. This means not judging someone's behaviors or how they may appear if they're doing something differently, without trying to understand why, and extending compassion for their why, and not assuming that they have bad intentions because they may appear or do something differently. And then six, your focus is on reducing distress and accommodating differences, trying to support the person rather than limiting their symptoms of neurodivergence. Seventh, a guarantee that worth is always given, that they or we are enough as we are, which is separate from our ability or how we can function. Eighth, using special interests to engage, giving more space to special interests, which are intense focus or interests that people who are neurodivergent can have, and how connecting and special it can be for us to be able to talk about the subjects or topics that we're passionate about, and how it can make us feel so much more connected to those who we get to talk about them with, and honoring that connection that we can experience from that. And then ninth, respect when the individual says no. 10th, centers and respects an individual's goals, needs, and interests on their own timelines. 11th, you are informed about sensory needs and you consider and plan for sensory needs. Often people who are neurodivergent experience sensory input differently than neurotypicals, which means that we can have unique sensory needs, like having dimmer lights that aren't overwhelming, or needing a noise machine on to block out excess noise, or limiting any excess noise because we can't stand the sound of a noise machine. It means giving space and asking questions to have our environments be able to adapt to us and our needs. So at the heart of providing neurodiversity affirming care for ourselves or others means respecting the preferences and insights of your neurodivergent patients. For example, to provide neurodiversity affirming care to autistic adults means to become familiar with the common challenges and co-occurring struggles that autistic adults experience. And this is an example of how working with autistic adults kind of requires these understandings, which can be applied to supporting and affirming yourself and others who are neurodivergent, which means being more familiar with common challenges and struggles that other people with the same neurotype or brain type or type of neurodivergence tend to experience, which can look like seeking out education and lived experiences shared from individuals and communities that have that neurotype. What is work to help support others with that neurotype or challenges may work to support you or someone else. For example, peer support, which you can see an example of peersupportspace.com, which is an amazing resource, which is peer support is where someone who shares your neurotype or someone who is also neurodivergent, for example, can share emotional support, knowledge, skills, can provide practical assistance, and connect you with resources, opportunity, and community. And that is something that if you seek out, you can find, and it can be incredibly helpful and supportive for neurodivergent folks to be able to receive that kind of peer support. And this can also look like unmasking and encouraging unmasking, which is a process where people who are neurodivergent can learn to reconnect with their authentic selves and embrace who they are in the ways that they diverge. Dozens of examples just like these are going to be shared via email after the webinar with support group options, educational resources from neurodivergent educators, activists, and organizations. So what does unmasking look like? Well, so here is an example of what this unmasking process can look like from @Lived Experience Educator. They describe how here are some steps for how to start this unmasking, right? Step 1, find out your values, interests, and what you like. Step 2, surround yourself with people who are safe. 3, advocate for your needs and identify your needs. 4, reconnect with your inner child. 5, remember that your unmasked self is valid. And this is one example of so many different people sharing different ways that you can do this for yourself. Now, where do we go next? What can we do with this information? Here are some action steps that I would recommend as great places to start. So this conversation so far has essentially been the tip of the iceberg. There is so much more to learn about neurodivergent experiences, how to be more affirming. So here's some ways that we can all get started and lift off of this foundation. Step 1, start to identify your biases. What have you been taught about people who show neurodivergence or who are neurodivergent? What are your resulting attitudes and perspectives based on what you have been taught? How does this affect your interactions with people who are neurodivergent or your interactions with your own neurodivergence? For example, if you are neurodivergent, you can explore that internalized shame you might experience or internalized aversions or judgments that you may have that's implicit for these folks and their differences because of the stigma. A lot of us were taught to think this way for a long time, and it takes work to uncover and reframe this. Step 2, learn from lived experiences. You can learn so much more about neurotypes and/or neurodivergence from people who have lived experiences with it. This can mean listening to or reading about it from educators / people who have that neurotype and learning about common challenges, strengths, and the individual culture that that community has. For example, if you want to become more aware and affirming for someone with Down syndrome, that can mean looking into what it's like to have Downs from people who do, finding writers or speakers who have lived experience with having Downs and learning from what they have to say about their own experiences. There are dozens of Instagram accounts run by people with Downs, sharing about their experiences and educating people. And that's something we can all access. And some of these resources I'm going to be sharing with you after. 3, Learn from the neurodiversity affirming practice green flags that we went over. If you are neurodivergent, what can you do more of to affirm yourself and or ask others to do to support you? What do your needs look like? If you are neurotypical, how can you make your interactions and relationships more accessible and affirming and supportive for people who are neurodivergent? So now that we've had this conversation and you've learned all of this information, please feel free to put in the chat, if you're comfortable, the name of the person or people that you want to do better with, that you want to be more affirming and informed for after this conversation. For example, myself, if it's for you, or a loved one's name, or a client. Please don't actually say the client's name, though. We want to be HIPAA compliant. Confidentiality is important. Or the community, or the neurodiversity movement. And as you're thinking about that, I am going to share who I'm doing this for. I am doing this conversation and I want to commit to doing better for myself, for me when I was a little kid, for me when I was a kid and I was so confused about why I felt different and so confused. And I didn't have a roadmap or anyone else to help explain why, what was going on. I want to do better for that little kid and for me now, today. And I want to keep learning and I want to keep working to be more affirming for myself and for other members of the community. So while you're thinking about who you want to do this for, and if you're comfortable sharing, please feel free to drop it in the chat. I'm gonna say a little final thank you to the researchers, educators, comrades, and writers who made this conversation possible. A lot of emotional labor went into this from them. I also want to give you some other ways to connect with us in the practice and me. Feel free to connect with us via Instagram at mytherapynyc and my own therapist Instagram at lived experience counselor. If you have any questions for me or want to continue this conversation, please feel free to email me. My email is anna@mytherapynyc.com. And if you would like to look at our practice website, learn more about us, you can go to mytherapynyc.com. And here is a preview of the resources that you're all going to be shared via email after this conversation. There are 2 pages worth and some great Instagram accounts that I definitely recommend. And then while I look in the chat at what you've said so far about who you want to do this for, also, please feel free, if you have any questions or any comments that you would like to contribute to the conversation, please feel free to ask in the chat if you have any questions, or raise your hand if you would like to speak. Please feel free to take your time because I'm also looking. I have a very big smile on my face reading through these. Thank you. Yeah, I just received a question from Shoshana that I really want to address. Shoshana said that receiving formal diagnosis can be very affirming and validating. I've noticed this, especially with adults who were never properly diagnosed in childhood, but accessibility can be extremely limiting, especially with cost. How would you approach this barrier with clients who cannot afford specialized assessments, but feel as though they need it to reduce factors like internalized shame? Yeah, I think that addressing the fact that getting a diagnosis is not always accessible or possible for everyone is a really important part of understanding neurodivergence. I think that trying to connect with resources or other means of diagnosis, if the cost or the ability to access an official diagnosis isn't possible, I do think that exploring and going ahead to explore a neurotype that you may think you have and going ahead and trying to find if you identify with it is a really important part of encouraging that. and trying to find someone access to finding solidarity for their neurotype, whether or not that they can access an official diagnosis or not. Because a big part of having a diagnosis or having that clarity, it can really help with that internalized shame, and it can be really transformative to receive a diagnosis. But not everyone can get one. Also, there are some added layers to diagnoses. For example, getting an autism diagnosis can become a part of your record that people might see and marginalize you for. For example, some countries don't let you emigrate there if they know that you're autistic. So being able to receive a diagnosis is not always a great thing because there can be limiting factors. However, it can also be a powerful thing to be able to receive that diagnosis. And there's a lot of complexities within that. And I think that trying to build access to knowing about a neurotype or getting some clarity around a neurotype is really huge. So thank you for asking. That can be a really longer conversation. I wish I had more time to talk about that. That's an amazing point. And then someone also DM'd me a question: what is the difference between neurodiversity and neurodivergence? And that's a great question because these terms are they're a little bit confusing. They sound very similar. So the difference is neurodiversity refers to brain differences that all people have, including being neurotypical and neurodivergent. So neurodiversity is talking about the overall human brain differences in functioning, and different ways of operating, and different ways of either diverging from social norms or operating with social norms. So it's an all-inclusive term about brain differences. Whereas neurodivergence refers to anyone whose mind or functioning diverges from dominant societal norms, standards, and expectations, meaning someone who's not neurotypical, someone who's not in that majority. Let's see. Yeah, good. I'm glad you found that helpful. So let's see. It looks like Melanie asked, how can we show the affirmation you speak of? I think that a great place to start is learning and not necessarily requiring the person who you want to be affirming for to teach you. For example, looking at the neurodiversity green flags for being affirming, going through those and trying to ask someone, how can I support you? What are your needs that I can accommodate for you? How can I make our relationship more supportive for you? And trying to see what they may be missing from you, or ways that they could feel more affirmed by you in the way that you are in relationship with them. And trying to let them have that choice while also taking the time and the emotional energy of trying to educate yourself from other people who do have that lived experience, and trying to bridge that gap between what a loved one has to tell you about what they're going through and maybe what they could use support in, while also learning yourself about what that experience is like for your loved one and their own experience of marginalization that could be a part of your loved one experience. I'm just looking through more questions. Yeah, Deborah, it looks like, yeah, that's a great question. So in terms of couples work, where one person in the couple is neurodivergent and maybe the other person has like a different neurotype, or the other person's neurotypical, it can be extremely challenging to go about couples work when you're noticing that neurodiverging differences between communication. And a part of what could be helpful for a lot of couples can be trying to figure out and name, well, where's this difference coming from? Why is this difference happening? And trying to go about doing some undoing internalized shame around one of their experiences, maybe some of the things that they've been struggling with. For example, like a couple with one person maybe has ADHD and is more impulsive or fast talking, and maybe they don't think the same way, or they're kind of all in with their conversations, and their partner is more slow and doesn't understand like why their partner is moving so fast and wants to get to the end of the problem that they're having. part of that conversation can be like trying to understand why one of their partners does move so fast, and what's that like for him, and does he feel a sense of pressure to try and get something done, and trying to figure out why they think that way, why they talk that way, and what it's like for them to notice the difference between them and their partner and the way that they communicate. And then what's it like for the other partner to notice that difference in communication or thinking or functioning, and trying to process their noticing of that difference, and also what that difference feels like for both of them, and trying to identify it and undo the internalized shame that can happen from having those differences in relationships. I'd recommend that being a great place to start. And I'm pretty sure there are a lot of couples therapists that are starting to work with couples and noticing these differences between neurotypes between their couples, which can be a big part of conflict. And I know that I'm sure some of them have some great guidance online if you want to look into that. That's a big theme that I've seen in my own couples work. So I think that's an awesome question, and I wish I also had more time to talk about that. And then the last question I have time for in our last minute is from Robert. What are the success factors of therapy for these folks? When can therapy end? So it depends on the person. Usually people come to therapy for mental health issues. And honestly, it depends on how long they're able to be in therapy, how long they want to be in therapy. And typically, therapy can depend on what that person's going through. And there's not some success factors that can be helpful for working with folks who are neurodivergent, who are coming to therapy for mental health issues, can be building the affirming green flag practices so that you have that supportive underlying basis for these folks. And that's an important part of it becoming a successful therapeutic relationship in my own experience working with folks who are neurodivergent. And I'm happy to continue some of these conversations and some more of the questions that I wasn't able to get to. Please feel free to email me and we can continue a conversation there. I'm happy to have these amazing conversations because I know how important they are. So please feel free to reach out to me if you have any more questions. Thank you all so much for listening, for engaging with the chat and the polls. I appreciate all that you had to say.